Hello, Valerie. Good, and you? For the eyes, I'm going to focus on periorbital rejuvenation. We know it's a very important part of the face, is to have good eyes and to look young. And this is what gives away our age. And also this is what can make us look tired or angry or depressed. So we always want to make sure the eyes are looking at the best that it should, because it's the windows of the soul. Good. So we have a beautiful patient here that has got a very good face structure. Let me just sit her up a bit. Okay, just sit like this. Can we zoom in a little bit on the face? Okay, so this patient we can see has got a very good facial structure for her age. She's had some treatments recently. She had some neuromodulators in the upper face, also for the eye area. Can you smile? Okay, so we can see the orbicularis oculi muscle is not very active because a month ago she already had it relaxed with neuromodulators, botulinum toxin. But she was complaining that she still has wrinkles remaining. And this is the ideal type of patient that we can enhance to make sure she looks good the whole year and not only when the botulinum toxin is active in the face. So I'm going to show you how to really rejuvenate all the wrinkles on the upper eye, the eyelid, lower eyelid, also the tear trough region, and then specifically, smile quickly. These lateral cheek wrinkles that goes over the zygomatic prominence. Okay, so otherwise she has a good skin quality. She's very healthy, so a very ideal patient that we can make pretty very easily. Okay, so when we look at the periorbital region, we always have to think anatomy. And you always have to know wherever you put your needle in, you have to know where you are. So I'm going to first start with enhancing the lateral wrinkles here. She has a very thin skin and not a lot of volume. So I could use Art Filler Volume, but I'm going to use Art Filler Universal because I think volume will be too strong and we will see the edges of the filler. We can see the skin, the subcutaneous tissue in this patient is very thin. She doesn't have a fat face, so I'll go for a more natural product. Okay, so for this region to enhance the lateral cheek wrinkles, we always have to think about this when we treat the eye, because it doesn't help this looks good, but this is flat. So that is very important. So the most ideal area to enhance this is basically on the whole zygomatic arch. So really there where nature gave us good prominence on the bony prominence. We know the safety regions. If we draw a line from the lateral canthus to the tragus, okay, so this is our first line of safety where we know we don't have any vascular risk. Then importantly after that is the line from the tragus, okay, to the nasal ala, just below this is our transverse facial artery and the parotid duct. So this is really maximum projection and helping the wrinkles there. When we fill up this area, we also want to make sure that we remain 2 centimeters below the orbital rim. Okay, and we'll talk about the orbital rim now when we do the filling also down there. So I'm going to start on this patient with the lateral periorbital wrinkles that extend onto the cheek region. And I'm going to use the Art Filler Universal for this. Okay, so my point, yes. Yes, especially if the patient needs it, and especially if they're very skinny. If we plump up this region, we make the eyes look better. And I'll show you, before I finish the rest of the eyes, I'll show you the difference between the two areas. Okay, so I'm using a 23 gauge needle for my entry point, and the entry point is on the safe region where we do not have any problem of nerves or blood vessels. Okay, and I'm going to use, you can use needle definitely, but you're going to use the cannula because she's skinny. I find the cannula gives you a better blending of the product than the needle. Okay, so this is Art Filler Universal that I'm really going to fan in this region to treat the smile lines that are extending down here. So it's not so much for volumization. It's not cheek enhancement, but it's more to enhance the tissue underneath. Like when you have thin material and you cushioning it underneath. So it's not very deep that you go with your cannula. Okay. Okay, so far I've used 0.2 that I've fanned in this region. Then I've fanned it a little bit just underneath the orbital rim, okay, to further just plump up this region to give the orbital area a support. So this is really not cheek enhancement, it's more tissue enhancement. Okay. This one is 50 millimeters, yes, yes. And then just to blend it in further, okay, then I go also to the lateral area, just to the basically the superior orbital rim to give it some support with the universal, and then you will see I will continue with the fine lines to get closer to the eye, but always beyond the orbital rim I will use universal. If I go within the orbital rim I will use fine lines, much more superficial. Yes. Okay, so with this universal product, I'm underneath the orbicularis oculi muscle in the deeper fat pad, just underneath the muscle. When I'm going to go with the fine lines, I'm going to try and be above the orbicularis oculi muscle. So it depends also on your product. Is that fine to answer? Okay, are you still fine? Brigitte? Ça va? Okay, she's good. Yes, so all around it was at least 2 centimeter lateral to orbital rim. Underneath the muscle that we use the universal, and you will see with my next products, I will be above the muscle, but for now it's underneath the muscle. Okay. Yes. What do I not appreciate about Universal? It's the perfect product for anything. It really integrates into whatever tissue you want to place it. It's not too thick, it's not too thin. You can shape it easily. It doesn't cause swelling, no nodules. You can see how easily I shape it. If I just push on it, it shapes. And I've never had any problem with it. Okay, so, okay, now, yes, I've used 0.6 ml that I've injected, basically all around the orbital rims to support the orbit. Okay. Okay, and then I'm going to go for the Art Filler fine lines to get closer to the eye. Because there the skin is very delicate, the muscle is very thin. The skin around the eyes is really very thin. On the upper eyelids, usually is less than 0.5 millimeter, as well as lower eyelids. And then past the lid cheek junction, the dermis becomes thicker. And that's why there's such a big difference in the skin below the lid cheek junction and above the lid cheek junction. So above the lid cheek junction, I'll go for fine lines because universal will be too thick for that region. Okay, so Always look for the vessels, even with your entry point. I'm going to use a 27 gauge cannula. Okay, but this is a 27. I prefer to actually use a 25 gauge needle for the hole, but we'll just wiggle a bit. If you're very careful and very slow and respect the region. Because a 27 gauge cannula can definitely damage the blood vessels, so you have to move much slower than when you use the 25 gauge. So whenever you feel resistance, you must remember that it could be a blood vessel. Okay, so you can see I'm much more delicate in my approach, much slower, not very hard, not very fast movements. It's a lot more superficial than I was with a 25 gauge cannula with universal. So this one is just underneath the skin. And here we're going to try and enhance the dermis by placing subdermal placement. We make sure that the dermis actually gets the collagen stimulation from underneath and the cushioning effect. Yes, with a 27 gauge. Yes. Yes. So the depth of injection is much more superficial. It's really the subdermal fat pad that you want to get into. There's more resistance in the subdermal fat pad than in the deeper fat pad underneath the muscle. So here we can see we are superficial. If I go deeper and underneath the muscle, okay, then you have to first go through the ligaments. Now you can see this is deep. This is not where I want to be with fine lines. With fine lines, I want to be in the subdermal fat pad. So it's really the cushioning of the dermis. It's very small quantities. So we've used basically for this whole region so far 0.4. And then I'm going to also move to the upper eyelid. They have some edema for maybe 2-3 days because of the hyaluronic acid. Okay, and now we can see that a 27 gauge actually can puncture a blood vessel. I was a bit too quick. So let's just keep the swelling there. I will complete that area now. Okay, then the last step that I do to make sure the skin really gets good rejuvenation is to use the NCTF to make sure that the skin also looks better and healthier and continues to stimulate collagen and to hydrate the skin. So I'm going to use a needle, but you could also use the needle roller to rejuvenate this area. Okay. That's okay. Okay, so for the periorbital region, obviously you could do full face, but I want to show you just the periorbital region. You can do the epidermal technique with a needle, okay, or you can use your roller, very superficial. And with the epidermal technique, you do not have to really worry about blood vessels. I always do a little bit over the brows because women lose some brows as they age. So it's good to also make sure that the hair growth remains good. HA, yes. Yes, and it will feed everything and give us all the vitamins that we are not taking in our diet into the skin directly where we want it. And it gives an amazing glow for the skin. Can I get that 32 gauge? Yes. You could use MHA18 with a cannula, but MHA18 has also got free hyaluronic acid. If we place it in the tear trough region, we can sometimes get more swelling. The long-term result is very good, but if the patient is afraid of swelling, then rather go for the fine lines. And if she has time later to have a bit of swelling for a few days, then you can use MHA18 as well, for sure. MHA18 gives a lot of hydration. If the skin is very dehydrated, then MHA18 is very good. Okay, so now I'm going to do some little papules. So this is Derma Epidermal Junction technique. Okay, yes. You can definitely use it, especially if it's a patient with a very thin, dehydrated skin. You can use it separate or you can inject it together depending on the regulation in your country. Sorry? Not at all. The papillas will go within 30 minutes. You can massage it, but no papillas to remain. Okay. This is the derma epidermal junction, and that is the junction between dermis and epidermis where all the nutrient transfer takes place and where hydration occurs of the epidermis. So it's very good for tightening and the deep hydration effect. Okay. Yeah, this is 135 HA. Okay. And you can go very close to the eye. Yes, it's very little quantity, and this is about 30 to 40-degree angle, and you have to make sure that you see those little mosquito bites forming to make sure, and they really disappear very quickly. You'll see as soon as I've massaged the area. Yes. Because we've also used the universal and fine lines, the duration of results will be much longer. So this patient's eye will improve every month for up to 12 to even 18 months for the studies that's been shown. But you could also boost maybe every 4 months with NCTF. But the fillers will only be needed to be repeated in 12 months' time. Okay. Yes. And even if she wants more, because usually when you start doing NCTF, the patients love it so much. I have patients that sometimes come every month for the whole year. They become totally addicted to what NCTF HA does for their skin. And other patients, they would come maybe before a big function to have a nice glowing skin and to hydrate, or with the changing of the season, they will have another boost with it. Okay, so let's see what we've achieved. We've just got a small little bruise that might make the results not look so spectacular. For NCTF, there's nothing. It's really safe. I use it even on patients that is doing chemotherapy. You can use it any age. You don't have to worry about what medication they're using. And I think that is the beauty of NCTF HA. Any skin type, any skin color, that you can use it. Okay, so let's see what it looks like, and let's try not to look at the bruises. The patient has a very thin skin and usually they bruise more. Okay, let me just take these markings off as well. Okay, can you quickly sit up for me? Okay, look at the camera. Can we zoom in a bit? Okay. Okay, so what we can see is the lower eyelid area is really thicker, it's stronger, it's got more of a luminosity. Can you smile for us? So when she smiles, we can see we got rid of these lateral wrinkles that we still see on the other eye. That crinkly effect compared from the one side to the other side looks better. What do you think? It looks good? Yes, you like it? The difference between the two? Yes. Yes, and even you can see the brow is lifted because I've supported with the universal, the orbital rim, because we know the orbital rim reduces in size with aging. So it starts to collapse. And by enhancing this, we give her a more youthful looking brow again. Do you see the difference between the brows? Yes, it's very good. The upper eyelid looks lifted. Can you look at the camera? Do you see the eyelid is totally lifted? Yes, the shadows look better. It looks very natural. Um, yes, this is perfect, perfect. Because many patients say when they do toxins, when they smile, they look unnatural. And here we do not have any reduction of the mimicking of the face. So they can still smile, they can talk, and nobody can see it. So besides some small little bruise that she'll have to put some makeup, she will be able to go out tonight and enjoy the beautiful weather and everything. Okay. Yes. Okay. So I'm going to continue with the other side. I don't know if you want to continue looking or I can continue. It's up to you. I'm not used to an assistant. Okay. So I used, can you quickly put in my ear? So I used zero point 0.6 ml because the Art Filler Universal is 1.2 milliliters. I used zero point 0.6 milliliters that I fanned basically over the orbital rim, below the orbital rim, on the cheek region and below, and also up here towards the superior orbital rim. And then I also used the Art Filler fine lines that I fanned above the lid cheek junction, more superficial, above the muscle, to rejuvenate the skin over here. And then the NCTF I used maybe 0.5 ml because it was just a small region. Is that okay? Okay. Less than half a vial of NCTF. Yeah, because a full vial would treat the full face and the neck region. Okay, so I'm going to start again the same. Remember, I said your safety lines, which I'm not going to draw on her, that we stay below the line from the lateral canthus to the tragus and above the line from the tragus to the nasal ala. And this is our safe zone, and it's really on the zygomatic arch, and there's not any major blood vessels. The major ones are below this line and above this safety line where we have the temporal structures. So we have some nerves here, but we pinch up the skin to lift. Okay, and we make our entry point. Yes. Okay, and a 25 gauge cannula of 50 millimeters or 5 centimeters with the Art Filler Universal. Okay. I'm using more Art Filler Universal to cushion the dermis. So it is really to not give, because she's got good cheekbones, but really to support the tissue because she's got these wrinkles all around that extends beyond the orbicularis oculi muscle and that remained even after she's had botulinum toxin. Okay, so this is below the orbicularis oculi muscle to support the bony structure and to cushion from deep below, and also below the lid cheek junction, at least 2 centimeters below the orbital rim. Okay. So, and then we basically really fan it in very gently and elegantly because she's a very skinny patient and we don't want to see the edges of the filler, and that's why I chose the universal instead of volume. Yes, yes, yes. You can at a later stage when the skin is better, I can use volume. But she's got a very delicate face, so she doesn't really need volume, but more the universal is respecting the thin skin. Okay. Yes, that's amazing because you can tell your patient what I'm going to do is going to improve your collagen for a year and a half. And there's no product that has got these amazing studies, and the patients love to hear this. Okay. E- 18 months. We hope for 18 years, but 18 months. And it's really for the prevention also of further aging, and not just for what we see now, but also to make sure the patient doesn't age too quickly. Okay. So you see I fanned all around the orbit to cushion the whole orbit around. Okay. And for the lateral smile wrinkles or crow's feet. Okay. Okay, and then I'm going to go for fine lines. Okay, so now I go closer to the orbit and basically within the lid cheek junction. Okay. And let's hope we don't give her a bruise on this side also, because she's got very superficial blood vessels. Okay, so now I'm using Art Filler fine lines on a 27 gauge cannula. Okay, now it's more superficial than I was with a 25 gauge cannula with the universal. Okay, and we see there's some very prominent blood vessels, so we have to be very careful. Yes. Yes. 27. Yes, you can use 25, but if you use 27, you have to just be very slow and very soft and patient. The reason I like it is because we have the amazing studies that show that it will give you 18 months of improvement of the crow's feet. We know fine lines will improve the collagen and elastin within the skin. So this is really what I want. MHA18 I like for hydration, but fine lines I really like for improving the derma structure. So yes. Yes, and the patients feel it. They can feel it on their skin also. Okay, so now we can see the fine lines. You can also fan very delicately on the upper eyelid region to also improve the dermis on this region. I just want to change a bit the direction of my cannula, if it's going to allow me. We do sometimes in a patient that's skinny like her. She might have some 2 days of a bit of edema. And usually I just tell them to massage the area, put some ice on. But the eye area can be very prone to edema. But there's no risk of nodule formation. There's no risk that the patients will feel the product because the product really integrates with the tissue. Okay, so now I'm really on the lid cheek junction. Do you see? This is the lid cheek junction, and this is what really contributes to that dark circle underneath the eyes. Okay, and then yes, 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 and then you can also take it superficially to further enhance the thin skin texture that we see. So you can, while you work, pinch the skin to see where does it still need a bit of a boost of collagen. Yes. So now we can see, if I now pinch it, already it looks better. Okay, and then lastly, I finish up with the NCTF. First, I want the 30 gauge. I do that a lot. I really love to do it because a filler will give you the dermis to improve and give you volumization. But NCTF is the only product that gives you that amazing glow and that will make sure that we get the collagen stimulation that we need from the fillers. So it really makes your filler work better. So it's the best partner for fillers. Okay. So this is the epidermal technique, and like I said, if you're not very secure with it, you can use your NCTF also with a mesoneedling device or electronic device. But the NCTF will really help to rejuvenate this region. Okay. What is it? Then the 32 gauge. And then I'm going to do some little papules to make sure that we get into the derma epidermal junction. And then we know the subdermal plane is rejuvenated, the dermal plane is rejuvenated, the derma epidermal junction, as well as the epidermis. So it's very precise. It doesn't take much longer to do this. It doesn't take a lot of product, but it really ensures that the patients get perfect results. Okay. Okay, so we almost finished. Then we can show you the result of both eyelids. You okay? Not painful? Yes. 4 millimeters, yes. Yes, it's inside the box of NCTF. Yes. 135 HA. Yes. Yes. And like you see, I always... Yes. And you can see also I do the eyebrow region because the women, when I do the eyes, I like to do it because the women lose a lot of hair with aging on the eyebrow. So this will make sure that the eyes do not just stay young, but also the eyebrows. Okay. Yes, so often when I do NCTF for the patient's full face, I would also do the most anterior region of the hairline because a lot of women have some traction alopecia from ponytails or and in South Africa we have a lot of African patients doing braiding and weaving of the hair. So then my NCTF starts basically from here all the way downwards to décolleté. The next step for this patient is to make sure that she can do some massage at home and she can continue. There's not really, she can do exercise, she can lie down, there's not any problem. And then I think it would be very good if she can come back in a month's time for a full NCTF to rejuvenate the full skin. And then in 1 year time, we can reevaluate where she needs fillers again, universal or fine line or just fine lines. Okay. Yes. Yes, I think that would be very good for this patient. I think I just put the cream in her eyes, so I'm not sure if she can open the eyes. It's okay? Okay. So we can see the eye region. Looks very natural. Okay. And I tell the patient they can do massage. If there's some edema, they can do with ice, and they can do some small little tapping movements. Okay, but it's very natural. She's got one small little bruise each side, but it's very easily covered with makeup. The brows look nice and lifted on both sides. As you noticed before, the one was lifted, the other, but no, both is lifted. The eyes look open, and so you can smile. Yes. And it's a very natural result, you can see. Can you see it on the screen? Yes. Okay, good. Yes. Very good. Okay. Yes. So if I really want to do only a brow lift, okay, then I would choose an entry point with a cannula, and I will really enhance the superior orbital rim, and I would take it further also to enhance the temple. So you basically fan it in, definitely with a cannula, and you would fan it in over the orbital rim, do the most of the projection there, but also do some lines over here that you do in a fanning pattern. By that way, you enhance everything to give a brow lift. Remember, this area is very thin, so we have got skin. There's not really so much superficial fat pads. That's why we see the blood vessels. So you cannot really be in the superficial fat pads over this temple area because it's too thin a layer. Then we have some orbicularis oculi muscle extension. Okay, and then underneath it, we have a little bit of a fat pad and then bone. So there's not much place to be. So you have to be underneath a muscle. Okay. Yes, you have to be underneath a muscle, and then Art Filler Universal is a very good product for this region. If it's very indented, you can go for volume, but volume takes a bit longer to settle in this region because it's much thicker and denser. So, thank you very much. Okay, so Valerie, you'll be next up to show your wonderful techniques. Thank you. Okay, just want to clean for. Just want to clean for you. It was painful?